Hi, this is Dr. Umesh Alegaonkar from Thane, Sampada Hospital. The topic of discussion is varicose veins and the related complications and its management. Nowadays, varicose veins and its related complications are the emerging issues in the medical fraternity. Patients usually present with a wake pain in both the calf muscles, usually after prolonged standing. Also, the calf pains in the night time. On examinations, we find engorgement of the vessels in the lower limb. The green colored varicose veins stands out usually, and on inquiry patient usually gives the tenderness or the painful calf muscles. If we proceed with the color Doppler studies, they usually we find out the incompetency of the vessels, incompetency of the perforators which join the superficial venous system and the deep venous system. Incompetence of the perforator vessels is the mainstay of the cause for the varicose veins. Apart from the leg pains, usually patients develops the non-healing varicose ulcer. Any ulcer requires purification of its blood system. It requires a good drainage of the bad blood and the good supplement of the pure blood. Varicose, in case of varicose vein, the drainage of the bad blood is away from the ulcer is not so proper. So, and around the wound veins and blood remains static, and because of the congestion, the varicose vein ulcer they never heals up. As the science has advanced, newer technology has come forward and which is very much prominent and gold standard treatment for the varicose vein related complications. We have laser ablation, endovenous varicose laser ablation treatment. Usually treatment completed within a day. A small nick is given into the patient's main vessels and the laser beam is passed under the sonographic guidance, and usually under the 12 millivolts laser energy is delivered into the incompetent vessels, and those incompetent vessels are permanently burnt off. That is the way we maintain the blood flow in only one direction, then there is no pressure changes around the wound and in the main system. This is quite a promising therapy which where there is no reoccurrence of the varicose veins, and it aggravates the healing process of the varicose ulcer. Patient can usually get admitted in the morning and have a discharge in the evening. What patient needs to do, patient needs to wear at least 6 months of stockings, and after that he can definitely take those stockings away. I would request all those patients who complains of wake pain in both the lower limbs should get their Dopplers done. They can diagnose the varicose vein problem at the early stage, and by that means if they are suffering from the incompetence of the varicose veins, they can definitely go ahead with the endovenous laser ablation. Quite a promising therapy, one should definitely think about it, as the varicose ulcer they are not healing and it takes lots of time of other means to heal, and at the same time it can save the time and the money of the patient by for which requires for taking care of the varicose ulcer. Thank you. For further any queries regarding the varicose vein and its complication, please contact lybrate.com. Thank you.